can see me now? Hello?
Yes, I can.
Yes, I can see Nikki. I can see Mercy Muradeyo. I can see Emilia, Sandra. I can see Oluke. Good morning, all of us. Hello, can we hear me?
Good morning, ma. Good morning, ma.
Good morning, good morning. Today is another antenatal class, and you are all welcome. I hope you enjoyed the last one. The topic was immunization and jaundice. So this morning, we are moving on to another topic. The topic is physical changes that occur in pregnancy. Physical changes that occur in pregnancy. We have 3 topics to look into. And we also have Hyperemesis Gravidarum. And the last topic is maintaining personal hygiene in pregnancy. Personal hygiene in pregnancy. I'm going to share my screen so that you can follow. I hope you can see it now. Physical changes and discomforts in pregnancy. Some of the physical changes and discomfort that we experience in pregnancy are caused by the 2 hormones that are released into the body of the pregnant woman during this time. The 2 hormones are estrogen and progesterone. And depending on how each of you reacts to it, the following physical changes will begin to, the pregnant woman will begin to experience the following physical changes. One of the common one of the common changes that you will experience once you miss your period and you do whether urine testing or blood testing to confirm pregnancy, and it is confirmed, then certain changes begins to take place in the body. One of them that is common is morning sickness. With morning sickness, the individual pregnant woman will begin to, the individual pregnant woman will begin to have taste, different types of taste that, that is uncomfortable. Ordinarily, things that you smell, perceive the odor, and doesn't have any effect on you, you will now begin to react to such smell. Sometimes we have heartburn. This heartburn happens when, maybe after eating, because of the hormone progesterone that causes relaxation in all the muscles of the body. Food that you have eaten will tend to come back to the esophagus. Because the food in the stomach is acidic, when it gets to the esophagus, you will have a burning sensation in your throat. And then there will also be indigestion. Some people feel indigestion. They feel like they have bloated, they are bloated up. And all these happen because the hormone progesterone causes relaxation of the muscles of the body. Another area where you can also experience change is in the breast. You know, the breast of the pregnant woman. The areola become darkened. The areola become darkened, and sometimes it can scratch. But let's first of all look at how we can take care of the taste and the smell that we have, the taste and the smell that we have during this when we have these changes in our mouth. You drink a lot of water, and then the smell that you cannot stand, you leave the environment where we have that kind of smell. Sorry, I'm trying to. Then another physical change that you can also experience is breast changes. One, the breast become large, big, is full. The areola becomes darkened, and you can have itching. So how do you take care of this? What you do is you wear a well-fitting bra, enough to cup the size of your breast. This will give you comfort and support. And then if there is itching on the breast, you can put a little oil on it to prevent dryness that brings about the itching. Another change or experience that a pregnant woman can have is dizziness, fainting, or lightheadedness. This is caused by, sometimes if you have not eaten, especially those who throw up in the morning, if you stand for too long, or you have not eaten and you are doing a lot of work together at the same time, you can have this dizziness and faint or lightheadedness. When you have this experience, try, if you are lying down, if you want to get up, try to stand up slowly. Avoid standing up too quickly. Then don't skip your meals. If you skip your meals, your blood sugar can drop, and you can feel like that. And then when you lie down, lie on your left side. It's better to lie on your left side because on your right side, there is a big blood vessel there that if you lie on, it will reduce, it can block blood supply to the heart, and you can feel dizzy. And then avoid wearing tight clothing, tight bra, tight clothing. Avoid wearing them. This will help to take care of dizziness that you can feel. Another experience that a pregnant woman can also have is fatigue and sleep problem. Fatigue and sleep problem sometimes happen in the first trimester. In the second trimester, tiredness is usually replaced with a feeling of well-being and energy. Sometimes some of us will notice that in the first trimester, that is the time you really have all the discomfort. But in the mid-trimester, the discomfort is gone, and you are strong, and you are healthy, and you can do all your chores. But in the third trimester, because of the size of the uterus, the exhaustion can set in again, because the uterus is getting bigger. And because the uterus is getting bigger, sleeping may be difficult a little, because you turn on the right, it's uncomfortable. You turn on the left, it's uncomfortable. Sometimes some of you ask us if you can lie on your back. Some say if I lie on my back, they said my baby, blood will pour on my baby's face. No, it can't happen. If you are going to lie on your back, lie slightly on the left lateral, not on the right, so that you don't, block the blood vessels supplying your heart. So if you experience fatigue and sleep problem, try to adjust your position. Any position that is comfortable for you is good. And then you can use extra pillow. There are some of us that have, we have all these pillows that, there's these long ones, that you can put in between your knees, you can put behind you. Something that can make you feel comfortable when you lie down is good for you. And then go to bed. Don't go to bed too late. And don't drink water too late in the night. You will be getting up to go and wee. Another thing you can also experience is, okay, we've talked about heartburn and indigestion. To take care of the heartburn and indigestion, eat small meal at a time and eat slowly. I've explained that because of the uterus growing, crowding your stomach, it will reduce the size of the food you can take. And if you take too much, excess can escape into your esophagus. And that, because it's acidic, it will give you heartburn. And then food digestion is slow. So eat little meal at a time and eat slowly. Don't rush your food. Then instead of taking water after meal, take it instead of taking water, after you have finished your food immediately, you can delay. Wait for some time before taking water, because water too also will occupy space in your stomach that is already reduced because of the uterus that is growing. Then, to avoid heartburn and indigestion, greasy food and fried food, they tend to take too long in the system, in the GIT. So if you avoid them, then heartburn and indigestion may not be experienced. Then avoid drinks and meals before you go and sleep. Some people say when they eat late, they have heartburn. Yes, it will happen because you are lying down. So don't eat when you're about to go and sleep. Then avoid lying down right after your meals. When you finish eating, it is not good to lie down. It's better to sit up. Another physical change that you can also experience is itching, stretch marks, and skin changes. Some pregnant women, they complain of itching, You will hear some, when they are scratching their body, it will be making some sounds. All these itching and stretch marks and changes in your skin, they are caused by the hormone I mentioned above. Those hormone causes your skin to enlarge because the uterus is growing. The skin of your abdomen too is expanding to contain the growing uterus. So what we do to ease all this discomfort is, 1, avoid hot showers, hot bath. You can use lukewarm water. And then don't use your nails to scratch you can break your skin. Rather, use your palm to just rub the particular place that is itching you. And then you can rub Vaseline. I'm sure some of us, we have different, you can use shea butter. We have different types of cream that we can use to rub on the particular area of the abdomen or of the hand, your hand, or the back of your buttocks or your thigh that is itching. Most pregnant women experience itching on their palms, on the palms of your hand, the soles of your feet. And rather than scratching with your nails, just use your hand to rub it. And then you can also put some cream on it. Like you can use oil, you can use coconut oil. All this will help to relieve the discomfort. Taste and smell changes. A pregnant woman, the food that they used to enjoy before, when they are pregnant, maybe the food they cannot tolerate again. And the smell is you try to avoid any food that you cannot stand so that you don't start throwing up. And any smell you cannot stand, try to avoid the environment where such is. Another physical change that you also experience in pregnancy is swelling. In a place, it is called swelling party. Some people, they don't experience swelling in the first trimester or in the second trimester. It is in the third trimester that they experience the swelling party. They know the face is bloated, the nose is swollen, the lips is swollen, the hands are swollen, the ankles are swollen, the feet are swollen. When you experience this, what you do, especially with swollen feet, rest your feet on a pillow, or when you are seated in your sitting room on a chair, get a stool and put your 2 feet on the stool so that it can aid blood return to the heart. And then avoid taking soup, food with salt. When the salt, don't use table salt, and don't eat food that has plenty salt. This will help to reduce all the swellings that you experience. Urinary frequency and leaking. This is also one of the experiences that a pregnant woman can have. Like when the uterus is pressing, the position of the bladder is in front of the uterus. So as the uterus is growing, the bladder is also, the size of the bladder, will be compromised. The bladder that normally will take like 500 mils of urine may not be able to take that much again, and you will need to go to the bathroom frequently. And sometimes when you run or you cough or you laugh or you sneeze, you can have some leaking, into your pants. So what you do at this time is ensure that wherever you are, you know where the bathroom is, so that if you have to visit the bathroom, it will be easy for you. And then for the women, you can wear pant liners so that when there is leak, when you laugh or when you sneeze, you know, it will, your pant liner can absorb the urine that is leaking. Then varicose veins. Most women, they may not have it in the first trimester, in the second trimester, but in the third trimester, they may begin to feel, you know, having varicose veins at the back of their legs or around the ankles on their feet. You know, all these are caused by, you know, the weight of the uterus blocking the return of blood to the heart and slowing down the circulation. So you tend to have this varicose vein. But as soon as the uterus is empty, all the varicose veins, they will disappear. When you have such, avoid standing up for long. And then, as much as possible, try to raise your legs. This brings us to the physical changes in pregnancy that can happen whether in the first trimester, second trimester, or the third trimester. Now we move to hyperemesis gravidarum. Hyperemesis gravidarum. This is an extreme form of morning sickness. You know, in morning sickness, you have nausea, you have vomiting. Some people, they only experience this when they want to brush in the morning, or maybe, you know, during the day. But, and once they put something in their mouth, you know, it stops. But hyperemesis gravidarum is an extreme form of this condition. It is a severe nausea and vomiting that the pregnant woman experiences. It is not all pregnant women that, women that experiences this. You know, constant feeling of nausea. This kind of woman, the pregnant woman, is always, it's not associated with you want to brush your teeth in the morning alone. Every time it is always there. At the sight of food, is there. When she's lying down, is there. And this woman will lose appetite. The woman vomits every time of the day. And such woman will become dehydrated. You know, when you are dehydrated, you are not eating, you know, the person can feel dizzy because blood sugar is low. And such women, you know, some of them, they lose weight. Instead of them adding weight as a result of the pregnancy, they will be losing weight. So with hyperemesis gravidarum, it's not something that can be taken care of at home. With hyperemesis gravidarum, once you come to your health caregiver or you see your obstetrician, they will advise you to be admitted in the hospital and you will be given intravenous fluid. These will help to replace the fluid that you have lost through vomiting, through spitting, you know, and for lack of being able to take fluid. And then you'll be advised to eat small but frequent food, especially dry food. No oily food, like all those toast, especially if you want to take, dry toast is preferable to bulky toast that has egg and butter and all the rest. And then you'll be encouraged to take dry biscuits, like crackers. And then instead of taking ordinary water, you can add a little juice into your water if you can tolerate it. And that will be able to take care of the dehydration. Now, we come to maintaining personal hygiene in pregnancy. Sometimes you see some pregnant women, when they are coming to the hospital, you just admire them. They can make up, they wear nice clothes, and you know, everything about them is good and beautiful. In fact, pregnancy makes them glow. But some, they react to it negatively, and you know, they cannot wait to be done with the period of pregnancy. So, but we encourage our pregnant women to maintain personal hygiene. The woman's body undergoes many hormonal changes during pregnancy, and this can lead to a lot of secretions, saliva, you know, the salivate, even the vaginal discharge, increased vaginal discharge, and you know, the nipple, their nipple discharge milk. You know, all these, if they are not taken care of, if they are not cleansed, you know, they can begin to give odor that you won't like. You may not even perceive it, but people around you may perceive it. So the areas where you can have increased secretion or discharge, one of them is the vagina. And you know, the vagina, if it's not properly taken care of, that is the entrance to the gateway where your baby is. The vagina leads to the cervix, and the cervix entrance leads into the uterus where your baby is. So you cannot afford not to clean that area. Your groin, you know, all those areas, when you wee-wee, it's good to wear pants liners in your pants so that you can change it. Even if you cannot change your pants, if you are in the office, you can change your pants liners as many times as possible. If you leak urine into it, or you wee and wee touches it, you can remove it and put another one. So to keep your vagina clean, wash with plain water. Don't put soap inside your vagina. It is not good. It is not healthy. It will destroy the normal bacteria that usually guard your vagina. So it is, it is advised that you don't use harsh soap to clean your vagina. Mild soap, toilet soap is okay. Just your labias, and then clean the inside with plain water. And change your pants frequently if you know that you don't have pant liners. For some who have pubic hair that is much, you can trim it so that you can have some air in the vagina. Breast is another area that you need to take care. We have said that sometimes when you are getting to the last trimester, some might begin to leak breast milk from their breast. And if it is not clean, and if it is allowed to stay dry, it can begin to smell. So we advise that when you have your bath, with the palm of your hand, wash your areola and your nipples. In fact, sometimes we advise that you put oil a day before, or you put Vaseline night before, so that when you wake up in the morning, whatever secretion, whatever things might have dried there, when you put water and soap on the palm of your hand, you can use it to wash it and it will be clean. But if you note that your breast leaks more, then you can wear breast pad. This will help to mop any secretion that might come from the breast. And it will also help you to avoid, when it's dry, you can avoid itching on the nipples and making your nipples sore. Oral hygiene is another thing that you also should take care of. Because of the hormones, salivation, some people they chew gum to make their mouth clean, to increase freshness, especially when you take mint gum is good. But apart from this, brushing your teeth every day is encouraged. It helps to remove plaque. It helps to remove, things that might have hide inside your, in between your tooth. After you have eaten, it helps to remove them. And instead of using toothpick, you can use dental floss. It helps to remove anything that might be lodging inside, in between your teeth, the gum, and you won't hurt your gum. And you'll still be able to remove whatever is hanging there. Skin and air hygiene. Skin and air hygiene. Some people, because pregnancy makes them to glow, it's easy for them to go to the salon, use all their products to take care of their hair. They can use their cream, they can use their soap, wash regularly. But some that react and cannot stand the smell of their products again, like the hair cream or the skin and the cream body lotion that they use, they will just leave their body. It is not advisable. We advise you to take care of your skin. Look for a cream that you can use, that you can tolerate the smell, and then wash your hair regularly. We have seen that some pregnant women, when they come near you, because you sweat under the skin of your hair, because you sweat, if you don't clean it regularly, it will smell. And if you don't wash regularly, of course, your body also will smell. So we encourage that for whatever you can tolerate, get it and use it to take care of your body. If your skin is dry, you can use Vaseline. Vaseline has no odor. You can use it and rub on your skin. It will help your skin to remain healthy. And your hair, if you have long hair, go to the salon and wash it. You may not put anything if you cannot stand your product that you used before, but at least tidy up your hair. You can braid it, you can weave it, you can set it, if you can stand it. And this brings us to the end of the topic, physical changes in pregnancy, hyperemesis gravidarum, and taking care of our body in pregnancy. I would like to take your questions now. You can unmute yourself and let's take your questions.
Good morning, ma'am.
Good morning.
This is Olamide Adedeji.
You're welcome.
I believe in pregnancy, your breast should be fuller, but in my own case, my breast is really flat, and I don't know why. Is it hormonal changes?
How long have you gone?
I'm my last trimester, my 34 weeks.
Don't worry. Don't worry. Once your baby comes, you will see that this breast that you think is flat, you will see that it will be full.
Just flat and it's falling. That's the problem.
I want to ask you a question. The size of your breast now, is it the same size as when you were not pregnant?
No.
So it has increased a little. It may not increase, like that, but it has increased a little. It cannot be the same. But wait until your baby comes and meat fills into the breast, then you will know that your breast can be bigger.
Okay, and another thing again about my breast. In my areola area, I feel I see scaly skins there.
Yes. So what you do, like I said, is in the night before, you have your bath on it and wash. All those scaly things, is the milk. Sometimes milk leaks from the breast. So when you wash it like that, it will remove all those scales. from the nipples and from the areola.
Okay, ma'am.
Yeah.
Maybe I should add something to the issue of the breast. My name is Dr. Bankole, and I'm the general surgeon. We deal with breasts. Now, different people have different sizes and shapes of the breast. And what keeps the breast standing and is the ligaments, the fibers that suspend the breast on the chest wall. When your breast becomes heavy, the likelihood is that it will sag. So for those people whose suspensory ligaments are not as very tough, then you need to keep them up in bra. The more you keep it hanging and flying, the more it's likely to sag. So this is the reason why you think it's going flat. It's not going flat, it's just that it's heavier. And because it's heavier, the weight is coming against gravity. Then for the areola that is scaly, just like the Mr. Adesina says, you need to give some oiling. Do some oiling so that you don't keep it dry. That is going to be very necessary for somebody like you with dry and scaly areola. Thank you.
Thank you, sir.
Thank you.
Thank you, ma'am.
You're welcome.
Good
Let's
morning,
keep
ma'am.
our questions coming. Good morning.
Good morning, ma'am. My name is Falaki Adetoku.
Okay.
I wanted to ask, ma, is it okay to clean shave before delivery? I'm in my 37th week, actually. Is it fine to do a clean shave, as in of the pubic area,
Yes.
to remove all the hair before
It's okay.
delivery?
Yes, it's okay if you can do it, but it's not compulsory. But it's okay if you feel good with it, it's all right.
Okay, so it does not affect both vagina or CS
No,
sections.
it doesn't affect.
Okay, thank you.
You're welcome. Let's keep our questions coming.
Good morning.
Good morning.
My name is Augusta. And
Yeah.
I joined a little bit late. And where I started was where you were saying about sleeping position, sleeping problem.
Okay.
So I didn't get that enough because in my own case, I normally have body pains. So I sleep with one side because they said if you sleep with your right hand, the blood will cover the baby's head or whatever. So I want to ask, can one sleep with the back? Or because normally I sleep with my tummy. Then since I was pregnant, I could not sleep with my tummy again. So it's giving me more difficult to sleep. So I don't know if there is another way I can sleep apart from sleeping with my left hand.
Okay. How far are you in your third trimester?
I'm in 25th week.
Okay, you are in the mid trimester. Okay. Your tummy is not very big, is it?
It's big though, but not
you
too
see,
big.
because some have small tummy and they can still lie on their back and be comfortable. But if you cannot lie on your back and be comfortable because of the tummy, then we always advise that you lie on your left side and then you can put pillow to your back. Either pillow or that comfy cushion that pregnant women use. You can use that and hug it. When you hug it, you feel better and you can sleep better. Yeah.
Good morning.
Good morning.
Please, I have a question that is not so related to the topic.
No problem. Ask.
So I don't have any of those swellings or things, but I have wrist pain. My wrists pain me like I hit my hand on something, and I know I did not hit my hand. And I've tried to read about it online, and apparently they say it's like secretions of hormones and things like that. But I just wanted to find out if there's anything I can use, because I mean, I don't want to use anything I'm not supposed to. I mean, sometimes it's very uncomfortable.
Okay, what I will tell you is, it's still part of the, it's still, everything is still part of the things you experience in pregnancy. But what is actually happening for some, because the baby is taking a lot from your body, so it's depleting your blood of some things. So I'm sure when you go to your antenatal class, your doctor will give you calcium because you need it. It will give you calcium and pain reliever to take care of the pain you are having at your wrist. And you can also do cold compress, to ease the pain. Hello?
Thank you very much.
Can I add to that? There's a condition that is called Tynos Inobytes. That is the inflammation around the tendons in the region of the wrist. That's also very common accomplishment of pregnancy in some women is hormonal changes. The approach to these ones, if that is the case, of course, the doctor will have some tests that they will do, some examination that will do to separate it from that which is due to low calcium. But the thing to do is to try and rest that hand that is painful for a while. That is, your husband will have to do more of washing for you, and then you have to rest it for a while it's still paining you. And then if you are not going around, you should just make sure that the hand is high up above, more than the level of your heart. That will help the drainage and will relieve the pain. Of course, if you are not getting better with that, I think you should escalate it and let the doctor see it.
Okay, thank you very much. Yeah.
Welcome.
Please, I have a question.
Okay.
Okay, so I keep having butt pain, and then the sole of my feet pains me a lot when I wake up in the morning. I can't match my feet on the ground. Can you hear me?
Yes, I can hear you.
Yes, so I have to wear like a soft slipper, so it stops when I walk around a bit. But then if I sit or lie down for a while, it starts to pain me again when I match my feet on the ground. And then my butt pains me a lot so when I sit.
Okay. Let me allow Dr. Bankole to answer that question for us. Dr. Bankole, please, can you answer the question?
Okay. That's a fairly common complaint that we have, especially among pregnant women. What happens is that, as you have said, as we have been told, there are a lot of changes that happens in the body. And part of these changes is the redistribution of calcium. So what happens is that when you are lying down, some calcium are deposited in the region of the tendons that is in the toe, in the sole of the feet. So when this calcium gets there and you now step on it, you're going to find irritation in the tendons, and that's will be very, very painful. But the moment you start walking around, the blood flow and blood supply will move the calcium away from there, and then you feel better. That's unfortunately is very difficult to control during pregnancy, but more often than not, it disappears after pregnancy. Now, in some people, the calcium becomes fixed, and we call that calcaneal pore. It will be fixed around the tendon area in the calcaneal, in the heel of the feet. And that one requires special attention. So that's why if all this, this thing is getting more than necessary, please let the doctor see it. We may have to do some tests to find out whether it's the simple redistribution of calcium or it's the calcaneal spot, which requires more advanced treatment.
Thank you.
Okay.
Thank you, sir.
Okay, thank you.
On that, I still want to ask on that question, sir. My own case is like, it is when I lie down that I feel the pain on my feet. That's from my ankle to my toes. And it's always severe. Like I had to wake up most times in the middle of the night to sit up, put my legs down, and then lie down again. So I do that at times more than 10 times in the middle of the night.
Wow.
So I don't have swollen feet. My body is not swollen in any way. My feet are not swollen. My ankle is not swollen. But the pain comes when I lie down. And, I have to twist my leg severally during the night from my ankle to my toes. Then the sleeping position too, I've been trying. I'm not somebody that used to sleep on my sides before. But since I got pregnant, at 37 weeks, I'm having to sleep on my left hand side. But most times I have to turn to the right because the whole of my left hand just goes numb at times with pain. So at times I have to turn again to the right hand side, So I'm asking that the right hand side is also okay.
Yeah, it's okay, but you can't. It's okay. You can't lie on that side for too long. But don't worry. Very soon, your baby will come and you'll be free from the sleeping problem. But the other question, I will ask Dr. Bankole to answer for you.
Okay, that is a very worrisome complaint you have given. So I think you should let us see you. There may be need to check the scan. What you are complaining is likely due to poor blood flow when you are lying down. And as the matron said earlier on, when you are pregnant and your womb is very heavy, it can begin to rest and lean on some of the vessels, which will reduce the blood flow. So when if the blood flow is as a result of pressure on the veins, then you are going to have swelling. If the blood flow reduction is on the pressure of the artery, you are going to have pain. So that's why it's good for us to assess you. So please make sure that when you come, tell your doctor that the surgeon during the class said you should see him so that I can assess and evaluate that leg. It's good we may have to do some scan for you to assess the vessels.
I've been complaining about it.
That's why I said next time you come, request that you want to see the surgeon.
Okay. Okay, sir. Thank you, sir.
We are having some noise at the background.
Hello, I have a question, please.
Please come up with it.
Okay, good morning. Good morning, sir. Good morning, ma'am. Good morning, everyone. Okay, please, I have two questions to ask. One is 32 weeks gone, and I usually feel pains on my hand. Like I can't hold anything for too long. Even writing, I feel pains like on my fingers. I don't know if it's normal. Then as regards sleeping issues, I don't know, is it right to sleep on both sides? I know they said sleeping on the left is better for easy flow through the mother and the child. I don't know. So is it, but I find it very difficult sleeping on my left. So I sleep on my left and my right. I don't know if it's an issue. I don't know.
It's not sleeping on both sides is not an issue. It's even okay. Depending on the size of the uterus, the discomfort, is determined by the size sometimes.
Okay.
For that, if you can alternate both sides, it will be okay. But the other question, I will still...
The pains on the hand.
Yes.
It's really, really severe.
Are your palms swollen?
No, they are not.
They are not. Okay.
They are not. I can't write. I can't hold anything for too long. The hands will be shaking. Like okay. It's really, really bad. The pains are really bad.
Okay, let's Dr. Bankole answer the question.
And that was the answer I gave the first time. I said there could be inflammation in the tendons of the hand. And that your own is a classical example of Tynos Inobytes. That is inflammation within the tendons. It's an hormonal changes that happens during pregnancy. Unfortunately, that kind of situation, you need to rest at intervals. That's why I said, maybe you were not here when I said that you let your husband do more of the washing and the cleaning so you can rest the hand. this unfortunately also might extend to early postpartum period, even after you have delivered. Some people complain that even to hold their baby for a while becomes more difficult. But when it gets
Okay.
to a situation where you cannot bear it, then we may have to do something. But that will preferably be after you have delivered. I pray your own will not
Okay.
extend beyond delivery.
Amen. Okay, thank you, Doc.
I have another question, ma. Sorry.
Okay.
Sorry, ma. I sleep on my left, but anytime I'm about to wake up at night, maybe to pee, I find it very, very difficult to stand because my lower abdomen is always really very, very painful.
Painful.
Very, I find it very difficult. Like it's like I'm groaning to stand up.
Okay. What I will advise is that when you want to get up or whatever, you see, turn to your side and then gently rise up and sit for
That's
a
the way
while.
I do.
You said?
That's what I do.
When you do that, it's still uncomfortable.
Yeah, it's still very, very uncomfortable. Very, very.
Okay. If you are in your third trimester, you know, for some, if the head of the baby are gone inside the pelvic ring, then you may begin to have that kind of discomfort at the lower abdomen. But I can assure you as soon as the baby is delivered, the pain will be relieved. I don't know if Dr. Banko can say to that.
I think I agree with you. The only addition I want to make is that it's possible that maybe there is a small fibroid. You know, you don't have to have a big fibroid to cause discomfort. When there is fibroid and the baby is growing bigger, the womb is growing bigger, the fibrous is deprived of blood supply. And then anything that happens in that area, because there have been locations before when people have been taken for emergency operation because of pain, only to find out that it's fibroid. So it's important that we check to be sure that it's nothing else dangerous. Sometimes there can be inflammation around the garment also, which can be very discomforting. But by and large, I don't think that that is injurious to the mother, to the baby, and it only can cause you discomfort. The moment you deliver, everything will be over.
Okay,
Thank you, sir. Thank you, ma'am.
you're welcome.
Hello, good morning. Please, I have another question. Good morning, everyone.
Good morning.
Well, I know this is supposed to be a common thing with pregnancy, but I don't know. How do you manage waist?
Manage.
How do you manage waist pain? Like my waist hurts. How else to describe it? And most times it gets worse at times where maybe I stand for long periods or sit for long periods. So I don't know, and it's becoming
Okay.
uncomfortable. Yes, ma'am.
Okay. You are heavy now. Are you in the third trimester?
Yes, ma'am. I am. Yes, I am. I'll be
Okay.
29.
Okay. You know what I will advise? In
Okay.
fact, you have also found the answer to it. You said when you said when you stand for too long. You see, the uterus is pushing and pulling at your back, and
Okay.
the pressure, everything gives you discomfort. So rather than standing up, if you sit down, it will relieve the pain and the discomfort you are feeling. So instead of standing up for too long, you know what we tell the pregnant women, that if you can sit down, don't stand. Are you following me?
Yes, ma'am.
If you can sit down, don't stand. But if you can lie down, don't sit. The pregnant woman must always opt for the better option. Don't stand, sit. But if you can lie down, don't sit. Do you understand?
Mm.
And I'm sure Dr. Bankole will want to tell you one or two things too.
Okay, ma. Thank you very much, ma'am.
Okay. Normally, the back is supported by the tummy, because actually there's no support for the back at the back. The muscles on both sides of the spine, they keep the back secured. And apart from that, the tummy also supports the back. So when the tummy is now pushed forward, it's pulling the back in the front. There's nothing to balance it out at the back. So that's why that happens with everyone with big tummy. Even if a man has a pot belly, if it is not pregnancy, he will have the same complaint. But what makes it worse with a woman is because of the relaxation of all the joints that have been spoken about in the first time, earlier on by the matron. The joints are relaxed. There's no support again from the front. And so therefore, every time you are standing, the gravity pulls and the strains at the back is increased. So I think another thing you can do is to ask your husband to massage you very well. That's what they say.
Don't worry, very soon you will relieve the load. All right.
Thank you very much.
Thank you, Dr. Bankole. All right. Well, in the absence of any other question, I think I want to thank all of you for joining this Zoom class. And I'm sure you have gained one thing or the other. So we wish you all the best in the journey, and God bless.
Thank you very much.
Thank
you very much.
Thank you.
Thank you.
God bless you.
Yeah.
Thank you.
Thank you.